And welcome back to the show, Dr. David Klein. He is my doctor, and we're going to hear from him 3 times this week, just like last week, and we welcome him to the show. He has a Stages of Life Institute in Longwood, not that far away from you out here in this area, because you can catch some of the back roads and be there in about an hour and 10 minutes. Not too bad at all, and a very scenic drive. The Stages of Life, of course, is a medical place. You can go and see the doctor and, of course, see all the people you want. But then there's a nutraceutical store, and then right down the hall there's another service that makes you look just as good as you feel. But I thought we'd take today and talk about nutraceuticals that are available to you that can truly help you, many times more than some of that stuff you're getting through the prescriptions. And the doctor designs these and has them compounded, custom made for you, and they're available online through stagesoflife.net. So doctor, what are the fastest selling nutraceuticals and why are they good for us?
Well, the first thing is, why do we really need any of this stuff anyway? And the answer is very, very simple. Your body is not able to make certain portions, certain elements, certain aspects of that which is necessary for you to live, survive, thrive, and grow. And so what happens is, we rely on our food supply for these items, which by and large haven't been there in years. Many of them can't be there because we're not able to produce them. They're called vitamins. Many of them we can't produce, and they're largely not there, called minerals or micronutrients. Then you have essential fatty acids, and oddly enough, essential carbohydrates. So what do each of these things do, and why are they necessary? And each one has to be addressed separately, because oddly enough, you can't get it all crammed into one product. So more times than not, what we are lacking are mineral products that have long been leached out of our soil. If it's not in the soil, plants can't pick them up. If the plants can't pick them up, we can't get them from the plants, and lo and behold, we end up with magnesium deficiencies, calcium deficiencies, vanadium deficiency, strontium, straight on down the line, and you're going to go, well, gee, A, I've never heard of most of these, and B, what do these minerals do? Well, what they do is they act as enzyme cofactors. The same thing that vitamins do, but a vitamin is an organic compound, and the mineral is not. But without these enzymes that are necessary to create one chemical to another, not to be confused from digestive enzymes that break things down, we fail to thrive and we start to die. The most common of all deficiencies in our diet, the most common of all nutraceutical deficiencies is magnesium. Well, what does that mean? It means that we end up with things like Alzheimer's, we end up with myopathy or disorders of the muscle, we end up with restless leg syndrome, we end up with depression, we end up with diabetes right on down the line. And many of these illnesses are preventable, not just treatable, preventable, if in fact your diet contains these minerals. So years ago, I was looking at things that caused thyroid disease and came up, oddly enough, and it's more mainstream now than it was then 20 years ago, was a product of nature called selenium. Okay, now selenium is a mineral. Most people have never heard of it. Or if you have, you're in the agricultural industry and you realize that if you don't give your cattle selenium, they develop thyroid disease. Well, gee, how interesting. Okay, we're no different than the cattle. We're both mammals. Okay, and we need selenium to create something called selenomethionine, which is an essential amino acid in the thyroid, and when it's not there, we become hypothyroid, fat, dumb, and ugly is what happens. So selenium is the first of the building blocks, but you can't take selenium by itself because it leads to zinc deficiency issues. So what I did was I started pairing, just like you do with a fine wine and a nice dinner, pairing selenium with zinc. And all of a sudden, my patients with thyroid disease started getting better. Now, the combination would cost them about $15, $18 a month. Okay, and that's not a big deal when you're ill, but just the same, that's what it was. And I'm feeling pretty good about myself. Heck, I'm out there fixing, curing, not really, but treating anyway, thyroid disease. And I've decided at that point I would start looking into diabetes. I figured if I could hammer thyroid, I could hammer diabetes. And started looking into it a little bit deeper and found that chromium, a certain valence of chromium, actually they're not all the same, they're different, would start lowering people's weight, which is something that was known for a long time, but it wasn't really widely recognized why or how it did it, and it did it at the insulin receptor. But when paired with vanadium, then all of a sudden people started getting off of their insulin. So what I did, I thought, hey, gee, this is pretty cool. Vanadium, chromium, zinc, selenium, and started hammering it all into one product that we called Magic Minerals. Why magic minerals? Because at the time my daughter was very, very young. I'm watching what's going on in society. 2/3 of the population's fat. Our kids are getting fatter. So I decided to have my daughter take this stuff. Yeah, it's kind of an experiment indeed. However, I did it, and I called it Daddy's Magic Minerals. That way she would grow up thin like the beanstalk in Jack and the Beanstalk. And she, oddly enough, took it as long as it was called Daddy's Magic Minerals for my little Bethany. Well, guess what? It became very, very successful. I was getting people off of insulin. I still am actually. And their thyroids are getting better. People were losing weight, and we cobbled it together at $24 a month. If you bought the individual elements, the minerals that are in this, it would be a little bit closer to 80. So my patients were able to afford it, and then guess what? I went ahead and started having it manufactured for use elsewhere, and it's still there all these years later at $24 a month.
Yeah, and it works. Okay, now how about this berberine that we keep talking about and NAC?
You betcha. Well, okay, I did not invent berberine, and I did not invent N-acetylcysteine or NAC, but I've promoted this stuff now for better than 20 years, and in a portion of the country, people never heard of this stuff. It's now selling off of other people's shelves, which is really kind of a wonderful thing. Well, what does NAC do, and how do you take it? N-acetylcysteine is probably the best antioxidant for the money that you can buy anywhere. What does it do? It converts directly into glutathione, which is the granddaddy of all antioxidants, but it has its own beneficial effect. It's a mucolytic. Well, what does that mean? Well, it thins the secretions coming from the parotid in the mouth. Well, okay, who cares, right? It thins the secretions coming from the pancreas. Well, if you have pancreatic and biliary issues, sometimes known as stones, it makes all the difference in the world. When you thin these secretions, they drain better. When they drain better, you don't end up with the abdominal pain issues that a lot of folks do when they have gallstones. Well, what's more is that N-acetylcysteine is the only medication that you can get, the only medicine, prescription or non-prescription, that deals with certain types of hepatitis, to include Tylenol overdose. This is unbelievable stuff. Okay, N-acetylcysteine, the Navy looked at it to treat nerve injury in the ears from blast injury.
Oh, wow.
I use it to treat prostatitis, and then more interestingly, of late, for autoimmune thyroid disease, because these things are promoted by persistent, although rather briefly, their tenure on life and on Earth is very, very brief, but these free radicals, it's a free radical scavenger. So N-acetylcysteine is used in different doses for different conditions, and this stuff is outrageously effective and very inexpensive at about $23 a month.
Goodness gracious.
So berberine. Now, glad you asked about berberine. Berberine comes from an herb. Okay, what does this stuff do? It lowers insulin levels, which in diabetics you would think you want more insulin, but you don't. You want less insulin. You want it to be effective, however. So what does it do? It lowers insulin and lowers blood sugar. At the same time, it reduces your risk of cancer, mind you, cancer, of all sorts by about 50%.
Wow.
So this stuff ought to be in everybody's diet regimen, as it is in mine, and anybody that's a patient of mine that has 22 or 23 bucks a month to spend. What do? You take the medication twice daily. Initially, you develop a little bit of upset stomach, perhaps some diarrhea, but then the weight starts to ease off. Interesting stuff.
Very, very cool. And Robin, could you tell us how we get a hold of the Stages of Life to either set an appointment or go online and maybe buy some nutraceuticals, and they'll show up right on the front door?
Absolutely. Our phone number is 407-679-3337, and our website is stagesoflife.net.
All right, and tomorrow when we sit down with Dr. Klein, we're going to be talking about, last week, remember we talked about erectile dysfunction? Well, now we're going to let the ladies have their turn. You go through that change of life as well, and the doctor's going to talk about some of the things that you can do to help get through that just a little bit easier, and we'll be talking about that and more. And if you have a question for the doctor, go ahead, and when you go to stagesoflife.net, just make a note on there that you want to leave a note for the doctor, or you can go on our Facebook site called the Rob Newton Resource Hour, the Rob Newton Resource Hour page on Facebook. You just leave a question on there for Dr. David Klein of the Stages of Life Institute, and we'll bring it right here to the store. You know that the doctor is on every Wednesday, Thursday, and Friday right here on the Rob Newton Resource Hour. And just about time for us to move on to yet another guest, and we want to thank all of you for sending us suggestions of more professionals that you would like to see on the show. We are going to get around to getting them on the air soon.